hello. First of all, let me congratulate you for this work. I thank you also, the ESA, for inviting me. And I'm really impressed by the work done by you, Rima Saleh, and Maria Baya. It's, we have so much evidence and research papers on health policy and the health sector in Lebanon, but this paper is more of the magic touch of the strategic management expert, where we are looking at the health sector from another perspective. So I really invite everyone to read the report. I read it, and it's really very insightful and very much interesting. So talking about the healthcare sector in Lebanon is now it's painful a little bit to talk about it, but whenever we see that at this time, all of you experts, wherever you are in your institutions, so you are attending, it means that Lebanon, yes, is sick, but Lebanon is not dead. So we have hope, and we are hoping to build a future Lebanon, I guess, because we take the opportunity of the economic crisis nowadays in order to move forward. And as Dr. Abdelmaoula was mentioning in the presentation, the adaptation part was there, and maybe we are reaching the transformation level whenever we come and take the opportunity of the economic crisis. Now, this, for me, this slide is very interesting. It really puts the 4 scenarios based on the economy parameter and the weakness and strength of the institution. So whether we will, and hopefully we will come from this quadrant to this, to the other one, it will all be based on different parameters to think of maybe tonight and together. So we saw, and I'm afraid to say that is the story and the history repeating itself. We saw a very beautiful description of the story in Lebanon. And the history were really starting the 90s, we didn't have anything. So basically, we didn't have a Ministry of Public Health, we didn't have National Social Security Fund, we absolutely didn't have nothing. And people were just paying out of pocket. And after 30 years, with the classification we had, it's something which is very satisfaisant. We feel like there was some reforms. So the collaborative governance was there, and collaborative governance was very well explained by Dr. Abdelmaoula. But is this enough? So for me, the question is, how can we move forward from this quadrant to the other one? So is the collaborative governance the only solution? Yet Dr. Ammar, and I'm fan also of Dr. Ammar, like Dr. Abdelmaoula, so did so many things during the years. So too much reforms, but it was really the adaptation. We didn't have anything, and yet we have the NGOs helping the primary health care. We had people treated, uninsured people with Ministry of Public Health, insured people with a private insurance or National Social Security Fund or Army or Civil Service Cooperative. So basically, all people were treated, and all people, we didn't have problems at the end because people were treated. But was that the ideal setting, the ideal scenario, or there are some missing parameters there? So if I might continue by saying that what really was like surprising us whenever we had the collapse is that we realized that yes, we were ranked 31st, that yes, the healthcare was somehow good, and we had healthcare services provided to all the population, but we didn't have a solid data infrastructure. So we didn't have data to analyze what epidemiological data all over the country. We didn't have cost data to analyze in order to come up with certain reforms. And yet, the whole healthcare system was very fragmented, pluralistic, complicated. So it was very hard whenever we had a collapse, like the collapse we are living today, to come up with one solution for all. All institutions are independent, so they have their own budget, their own laws, their own regulations. So the vulnerability of the healthcare system in Lebanon, because of the fragmentation, was something which was very difficult to tackle. So this is very important to mention, and I will keep the answer for Mr. Nasr. So I'm sorry.
Thank you, first of all, for the invitation. I think, in fact, it's an important subject. And as you said, Lebanon is sick, so everybody is in the hospitals. And it's complicated to deal with the old system today, with all what we have as crisis. Our dollar was at 1,500 today. Each day it goes up for 1,000 or 1,500, even on Sundays. So what we need to do, the difference is that we are living today not only a transformation. We are adapting, okay, the private sector is adapting. We need to keep in mind that always Lebanon was relying a lot on the private sector, even with the PPP partnership, but today we have a partner that completely disappeared with no governance, which is all the institutional authorities or government or ministries or others or social security, etc. And today we are pushed toward the transformation. It's not a transformation with our own will to go into transforming a system with all scenarios, adapting, strategics, doing everything with all what we can have and analyze as parameters. We are completely pushed to go into adaptation and transformation due to all the crises that we are living. And we have a very important partner that is no more here, something like this. Today we have a lot of private hospitals. It's not the case of Hôtel-Dieu, but it is we are limiting a little bit the governmental patients because the tarification does not fit the availability of medicine, all what you know about parameters that are today missing from the equation. And one equation, there is a lot of parameters. One of it is economics, another is the partnership, medicine availabilities, tarification, etc., etc. So whenever a lot of parameters disappears, you need to work alone. And this is why being alone, you are pushed to an adaptation and transformation. And we are going to, you have mentioned the transformation, but the difference is that today the transformation is not with our complete will, is not a consultancy based or with parameters to be analyzed, getting conclusions to a transformations, but we are really pushed to be a little bit transformed. Now the economy is completely collapsed. We need to analyze the situation as it is. We cannot continue with all what happened before, even at the beginning of what was created after the civil war. Yani you mentioned a little bit the system, private sector, the 10% budget, and now it's 80% budget. Today, even with that, you cannot go into the hospital. I'm speaking for the governmental patients with all these budgets. You need 10 times the same budget to little bit realize that maybe 10% of what you were doing before that you can do today. So the complete equation is completely disequilibrated. Yes, the private sector is holding, it always hold, but today with a lot and complete difficulties, not only dollars and economy, but also availability, subsidies, the systems. We are in a completely non-governance system, like a car without a driver. It's something like that. And the private sector cannot hold alone. So this is why we are pushed to a transformation very fast.
Let me be very provocative. And I'm talking, non, c'est pour vous deux, en fait, c'est plus pour vous. I told you when I invited you, I told you by mail, vous allez être le grand méchant de l'histoire. And you told me, no, I don't have any problem with that. And I don't think, frankly speaking, I think that Hôtel-Dieu de France are not pure private hospital, meaning that your purpose is not maximizing money. It's breaking even and healing people, I guess. So this is why I'm asking that question. We relied completely on the private sector. We don't have public hospitals due to lobbying, due to general policy saying we have the private sector taking care of the system. In parallel, I guess that the experience of Rafiq Hariri proved that private hospital can do a super good job. Eventually, the difference between the private sector and the government, as a private sector, and I'm working in a business school, you cannot work without at least breaking even. Government are used to work with deficit, and very often, le reproche that we do to government saying you are in total deficit, we should eventually find a system. Do you think that we can continue in the future having a health system working with a minimal number of public hospitals and relying completely on private hospitals?
It should not be the case. You cannot run a country relying on the private sector. Else you give the country to the private sector, and you don't regulate it, and you don't use the, and you eliminate ministries, and you don't need any authority. It cannot be like this. The private sector need regulation. But this is the basics of a public governance. You regulate, and the private sector works. You cannot, nobody can take, I think, the, let's say, the scope of the other side. Now, in this case, in the health system, it was a little bit a combination of the two systems, which is good and not good. It depends on the issue. Now, of course, the private sector, Hôtel-Dieu or others, yes, it's not only private, and you see that there is a lot of private hospitals that were founded by congregations or priests or missionaries or something like this. So we have a social vocation somewhere, which is more important than breaking even. We always manage our companies on P&L, profit and loss management, etc. Today, you only manage your hospital for end of month's cash flow to pay salaries, fuel, which is a national issue, and how to have availability of medicine. You can ask any chief pharmacist in any hospital if he doesn't have a complete issue with the availability of medication. So I think that today the partnership is important. The transformation is here, is done. I think that the transformation is done. Today you don't have all the hospitals that accept public patients. So the transformation is done somewhere. Now you need only to regulate it, to write it, and to respect it. It's not the case of Hôtel-Dieu for several reasons, but it's only a case. But also for us, this is maybe an example that we have discussed. It is also an opportunity somewhere, because big hospitals can hold and can manage to have synergies and can have to have scale economy, and this is why we are going in few weeks maybe to have a complete Hôtel-Dieu de France network with other medium hospitals that cannot hold the shock that you were speaking of, which is the economy today. Okay, it's an opportunity also. You asked me if it's bad or good. It's good because we signed it, and I think it's good. And I was answering only the. But it is an opportunity, but it will help also the private sector creating a network and transforming. And once again, I would say that transformation is done, it's finished. Now you need to regulate it. We are in a complete adaptation. You need only to put laws in front of the reality. Generally, you put reality in front of laws. Today, you need to have reality, just writing the laws that can adapt the system that is happening today. Today, what you see is something happening, which is not written in what we've done the last 25 years.
What I want to add here is that maybe for Lebanon, Lebanon example is really the power of adaptation. We used to adapt ourselves. We used to adapt ourselves several years ago, and now with the crisis also we will try to adapt and adapt and adapt. We never put a vision like short-term vision, medium-term vision, or long-term vision. So, thank you. So basically, the thing is that if we start by putting this long-term vision, as it was mentioned, universal health coverage, having access to all people, so we cannot rely on the private healthcare sector. So basically, sure, in order to answer your question, we have to start thinking about reshaping the healthcare sector, the public healthcare sector, in a powerful one, not just focusing on the adaptation, putting plans, and starting working in order to reach those objectives.
So eventually it's reaching.
This is a very difficult question. So it's not something which is very simple when we come up to solution in the transition period. But the first thing, I guess, a very crucial and important thing that we mentioned is that the collaboration at this time is very essential. So public-private partnership is really essential. A transparent framework between those entities is very important. The second thing is that we cannot say that the transition scenario is not divided into several terms. So short term is an emergency. So when we talk about patients, we are not talking about electricity and water, and we are like waiting for reforms to come in order to get the IMF help. So the patient cannot wait, and the urgency of the transitory phase is yet to start with a short plan, and then move to a midterm and a long term. So the short term is basically very simple because it will rely on the money. It will rely on the funds that we have. But in parallel, we have to put like long-term plans in order to reach the transformation and to be independent. Can we always rely on having NGOs and having charitable organizations helping us and having private donations? So we cannot sustain. This is not a healthcare system. So if we want to build a healthcare system, we will put the strategy and then work on this transition to reach there. And one thing that previously done in those 2 years is trying to look at other countries. So basically, Lebanon is not the only country in the world facing this economic crisis all over the world. So we had several economic crisis with 75 countries all over the world in 2008, 2010, and we have several examples to mention what they really did in this transitory period to reach the sustainability of their healthcare system in 2022. So Greece is an example because the healthcare system in Greece is fragmented. Egypt is an example because also they try to separate the IMF help from the reforms and others. So it was special for the health because it's something which is not comparable to other goods. We can look at several other also. Cyprus also, yes, Cyprus also. We can look at several entities. Even in Iran, they try to empower their local production, not to rely on the also importation. So in order to be self-sufficient for the years to come, we have Argentina, we have several entities. So try to look at other countries, try to take some scenarios, applicable ones, collaborate with all key stakeholders all over the country, and put plans in order to reach a sustainable, because our aim is not really just to live the day by day, it's really to build this healthcare sector. If we want to do a real transformation and take the opportunity of the economic crisis we are living.
Thank you very much, Mr. Nasr. How do you think we can negotiate that transition?
First of all, I think that the day by day is working somewhere. Is working somewhere in the private hospital or other. The day by day is working. You mentioned a lot of film titles. I like the idea. You forgot maybe Ghostbusters because you have each day something coming from.
It could be the transition.
Okay, so
you're right.
Transition. Virtually, it is here. Yani, now you need only to write it, to phase it, to apply it, to regulate it, to write the laws, and unfortunately, the practical issue of this transition is already done. A lot of private hospitals do not accept anymore governmental patients. The public hospital cannot, else it was done 30 years ago. They cannot accept all patients of the country, etc., etc. Today, the transition needs to be phased, but we need to go fast. Today, we are as slow as with a complete disproportion with the dollar toward the Lebanese lira. So you need to phase it, plan it, but it is already done. It is already done with a lot of issues that we are dealing with day to day.
Thank you very much. Thank you, everyone. We are going to take a couple of questions. We promised that we are going to talk about it. On va commencer par Monsieur Hassan.
Merci. Je m'appelle Fadi Khouri. Mirna, merci. You went into the heart of the problem. Let's divide it. I don't want to take the microphone too long, but allow me just 1 minute, please. So we have to plan in everywhere, and you gave examples. Where you have a crash, you do not rely on the government to raise, not in the future, in the near future. So we are talking in 5-10 years ahead and forward. So we have to create an independent entity which lead or manage and plan the future. And the future is so simple. It's the right of everyone in any country to have the minimal in healthcare. And then the private sector, whatsoever insurance, whatsoever private hospital, private provider, whatsoever else, it will be on the top, which is the VIP or the private treatment. Now, if we take a brief overview on the market, متشرذم, I don't know how to say it in English. Fragmented, exactly. So what is the solution? It's one only solution. Give solution. I think a lot of people can study it much more deeper than, but I guess if I look just to copy, so simply and so stupidly, if you want to copy Egypt, Cyprus, Greece, everywhere, okay? They created they are going into a massive 100 million healthcare free of charge for their population. So it's only creating an independent and not politically influenced, and the money will be raised by a certain small taxes from here and certain small taxes by there. So I think it's, I don't want to say simple because it's complex, but it's not impossible to do. That's what I want to say. And thank you to listen of what you said, to plan. We don't plan. Meanwhile, it's where I come to thank you. Meanwhile, yes, we don't have other than you and the private sector, insurance or whatsoever. But it cannot replace, and it cannot last long, because up to a certain point, nobody will be able to pay you.
Thank you very much.
Thank you.
Thank you very much.
Thank you.
First, I'd like to thank you for this lovely conference. My name is Abdelmaoula El Chaar. I work for Lorient today. My question is not, I'm not an expert in healthcare, but more on the financial side. So I have two questions, actually. Given the political economy of our country, what were the drivers behind the success of the healthcare system, given the weak institutions that we had all across? And the second part, where are we transitioning to? Given that we have less than 50% of the people who have healthcare insurance. And second, I've heard recently that the occupancy rate at hospitals is less than 50%. So where are we transitioning to? Are we transitioning to a freak system where, like you said before, that nature abhors vacuum. So we're going to go to a system where it's dominated by the private sector and where 70% of the population does not receive the healthcare coverage that they should. So is this the transition that we want? So this is my question. You know, we are transitioning towards what?
This is a very important question. First, let me thank Monsieur Fadi pour l'intervention. Can I comment on the two questions and later you comment? Okay, so first, I'm really happy to hear the experience you shared. I always believed in all my work within the governmental sector through 15 years that a multidisciplinary sharing experience all over all experts in Lebanon is essential and not to rely on one institution apart. Examples and the simplicity of applying scenarios in Lebanon, I believe they are between brackets simple. Yes, as you said, because Lebanon is really a small country compared to other countries. So whenever you compare Lebanon to Egypt example, and yet now they are in the universal health coverage with basic healthcare services for all citizens in Egypt there, with putting 2030 vision and starting to do it. So the Lebanese example with the expertise and the elements we have in the country is there, and simply we can access it with having this basic healthcare services provided to all people equitably without any differentiation between what coverage do you have. So this is, and thank you so much for your comments. And to answer your question, it's a very difficult question, where we are going. So if someone has the answer, so we would be relieved. So we don't know. We have so many uncertainties there. We are trying to gather all sorts of expertise in order to find solutions. So basically each and every single entity is trying to do it. ESA is trying also to do it with sharing all this history of Lebanon and trying to perceive where we will go. So try to learn from the history, try to know where you are and where can you go. So we can go to a really transformation which is ideal and very positive and really benefiting and taking the opportunity to do and to change because of the economic crisis, as Cyprus did whenever they started also introducing the health technology assessment and the economic evaluation of all healthcare services, trying to do evidence-based decisions and not only to rely on certain decisions. So do we really want to change and transform the healthcare sector into a better one, or just doing this because we are used to live this day by day and we're fine because we're fine. We have the power of adaptation, and basically I wanted to put the title of the health services for the many, so many health services so for the many, so maybe the power of adaptation of Lebanon, so it's really huge, but we don't want to repeat the thing. We want to put a plan, start to think big, start to think really on a larger scale, put a vision like all countries are doing, and start to build it step by step. So to answer you really about really where we are going, I don't know where we are going. We are trying to go to a better future, but we are sure that the public part has to be strong. So we used to blame the private sector, but the private sector is a profit, it's a profit organization. So basically if the public is powerful, then laws and regulations will be applied and we won't have this, this imbalance between the two parties.
Thank you very much.
Exactly.
I think if I may, and I'm no more a speaker, I'm one of you. I think that we cannot decouple the health system from the general system of our country. We were talking about a solution. Actually, in the 90s, they decided to create 21 public hospitals. A couple of them were created. The real question is why? And when we will be able to solve this, eventually we would have solved a lot of problems. When we talk with the private sector, they're not against a public sector which is strong, that can regulate and where they have visibility. But eventually there are the interest, and this is we as Lebanese to decide what kind of country we want and what kind of system we want. I think this is eventually for Lorient today the main question eventually.
And I would like to be a little bit more provocative and to look at the question from another point of view. I don't think the issue is public and private. And to my understanding, there is no public sector in Lebanon. The law of 1996 that gave the autonomy to the public hospital, the public hospitals are مؤسسات رسمية. Yeah, they are organizations that must balance their budget, that cash from patients, that spend autonomously their budget. They do not even send data to the Ministry of Health. So we do not have really a public sector in Lebanon. What we are, when you say that there is and Hôtel-Dieu, those are non-profit organizations, and the public hospitals in Lebanon belong to the government, and they are not for-profit. So I want to stress this issue, because when I say that we must develop the public sector, it is now all the trend in the world. The major health sector reform in the world now is the Vision 2030 of Saudi Arabia. And in this vision, all the hospitals that are run centrally by the government now are asked and requested and forced to become entities run on the private model. The NHS in England, the oldest public healthcare provider, is also moving towards management the private way. So I think our issue is a little bit different. And I think we should tackle the real problem. The real problem is not governance. The real problem is economy, is money. And I cannot make the comparison with Cyprus or Egypt, because Cyprus and Egypt and even Greece are coming from a non-system. They are starting building the system. Yani the people in Egypt were at 90% kind of excluded from the healthcare model. In Cyprus, 2 years ago, they started the coverage and the NSSF model. So now we are totally different. We had a very developed model, and we are going back, while they did not have a model, and they are moving forward. Our model is unique in the world. So the transition, I think it cannot be from down, it must be from up. Yani, I believe what we have to invent all together now in Lebanon is how are we going to give the same quality of care and to keep what you were saying, which is very important. In Lebanon, everybody has access to care and to high-level care because of this partnership between public and private, where the public sector was buying care from the private sector at 90% of the budget of the ministry was going to the private sector. So to come back to now the transition that we must make, we must reinvent our model of providing care. For the past 2 years, with all the subsidies and all the stuff, we were doing wrong. We cannot continue buying from MSD, with my respect to Mr. Bibi. We must go and find drugs in India, in China, that are less expensive. We must reconsider our way of treating patients and giving the same quality of care. I think that's the challenge and that's the move. And I think we should go upward. The example, Dr. Chaar of Shuf, is very interesting, but it's not weak institution. It's strong institution, because the institution that's strong is the PSP. And you will have the same model in the southern suburb. And when you have an authority that decides to make the system function, it can function, but it cannot be generated, and it's not sustainable. So I think what we should try to develop is to have a clear transition through changing completely our model of provision of care to be able to keep the same access and the same quality.
Thank you very much, Dr. Otayek. For the people who doesn't know Dr. Otayek, he's the director of AUB. Thank you very much. AUH, actually. Thank you very much. AUB. beaucoup de choses. Thank you very much.
Can I agree with Dr. Atay thank you, Dr. Atay, for your intervention. So basically, yes, we cannot copy any health care system, nor a reform, but what we were trying to say is that we can take some ideas about reforms done. Like, for example, we cannot copy, and you are totally right, and we know that our healthcare system is really very special. It's not bad or good, so it's the healthcare system. We have to accept it as it is and try to make it better. So basically, this better is this learning from other countries facing economic crisis. Like when we say start to apply the economic evaluation concept that Cyprus adopted, we can start by doing it. Put a certain cancer prevention plan at a national level. This is also important, and we took some parameters and we try to adapt it to the system we are living in order to reach a point where we have access to healthcare for all the Lebanese population equitably, because those 30 years were fine, but they were not equitable. So basically, one patient in the same building is treated better than the other, or not treated at all because the coverage is different. But I agree with you that we have to think big, not to copy a sector, but try to make our system better. And what I agree also, a second point, is the PPP, the public-private partnership, in a well-established and framed process is very essential, this is one of the empowerment parameters that can help in this transitory period to reach this sustainability. Thank you.
Thank you very much.
Dr. Ahmed Mourabi, je vais m'exprimer en français, c'est plus facile pour moi.
Pour nous aussi.
Je suis un ancien de l'ESA et on m'a appris à l'ESA que le système de santé libanais est inflationniste. Ça, c'était dans les années 2010, etc. Bon, la bulle a explosé. On est dans une situation complètement catastrophique, il n'y a pas d'argent, comment faire? Qu'est-ce qu'il nous reste? Il nous reste les soins primaires. Le système qui doit être généralisé, c'est les centres de soins primaires, et il ne faut pas s'attendre à arriver, tout le monde n'ira pas à l'Hôtel-Dieu ou à l'université américaine. Moi, je dirige un établissement en périphérie et on a eu des difficultés énormes et on s'est adapté. On a essayé de vivre au jour le jour et on s'adapte. Et on continue de s'adapter. Pour moi, je pense que si on continue le système, là, pendant des années, on va souffrir. On va rester sur les soins de base qu'il faut soutenir, améliorer, contrôler. Par contre, pour le reste, pour le faire évoluer dans une phase future, on ne sait pas, on n'a pas de vision encore. La seule vision qui apparaît, c'est la décentralisation. Qu'est-ce qu'elle va donner aussi au niveau santé? Donc, tout ça, tous ces éléments, il faut les regrouper pour aboutir, à mon avis, à ce qui est actuellement en vision à long terme, c'est les 4 P, c'est-à-dire la médecine prédictive, personnalisée, participative et préventive. C'est surtout la prévention sur laquelle maintenant on peut jouer dans cette période.
Merci.
Et, il reste encore une chose, c'est que ces 4 paramètres ne suffisent pas. Il y a 3 autres que je voudrais ajouter, c'est l'adaptabilité, c'est la responsabilité. On est de moins en moins responsable à tous les niveaux. Et la 3e, c'est l'éthique. Si on arrive à joindre tout ça avec des soins primaires, tout simplement, je crois qu'on peut traverser cette période difficile.
Merci
voilà
beaucoup.
Ce que je voudrais dire.
Merci beaucoup, Dr Mourabi. Ce que je vous propose, nous avons prévu un buffet. Il fait très bon maintenant dans les jardins de l'ESA. Je vous propose d'aller continuer cette discussion dehors. On prend une dernière question, Thomas, et puis on ira continuer cette discussion dans les jardins de l'ESA.
Dr Chaar, merci. Ce n'est pas une question, c'est une affirmation, si vous permettez. D'abord, merci pour l'invitation.
Je vous en prie, vous êtes plus que bienvenue.
Très intéressant aujourd'hui. My name is Sami Reza. I am the CEO of the Lebanese American University Medical Center as a hospital. I would like to just say something. We have to leave, I think, this meeting with a positive note, all of us. I think we are in a transformation system that cannot sustain today. It's clear it cannot sustain. Today we have major issues with our human resources. Our physicians are leaving. Our nurses are leaving. Our IT staff is leaving. We are not able to retain them after several retainment programs. We have no more subsidy from the central bank. We have no more oncology products for our patients. Some of our patients are dying at home. We have issues with the government, social security, 5,000 مليار dette من الدولة للضمان. L'indemnité de fin de service de nos employés sont à plat, etc. أنا برأيي اليوم لازم بالعكس following your presentation is to join forces, all of us. I think academic centers, public centers, private centers. The PPP in Lebanon has always given a great quality of care. As you said, we were better than the US only a few years ago. The problem is that we have no more budgets. We need budgets to restructure our system, or maybe we should restructure our system before we inject budgets, either one or both together. We have done a model having a second hospital in Jounieh, the St. John Hospital for LAU, and I really think it's a great thing that Hôtel-Dieu did with 2 hospitals. Maybe part of the last quadrant, the Phoenicia, could be to have academic centers like AUB, like Saint George, like USG, ourselves and others, is to join forces with other public or private sector and hospitals, because believe me, this can reduce our costs in economies of scales, in procurement, in IT, in HR, etc., even with physicians and nurses, etc. So I think we are definitely learning the tough way. Like Nassib said, we were pushed to this transformation. We wish we had the time to build for this transformation. Today, I think we are pushed. It's fine. We are a resilient Lebanese people, and we know how to manage difficult situations. The only thing is time. We should be able to go fast and try to find solutions fast, because this system today is very difficult to sustain, frankly. And thank you again for having us.
Thank you very much. La dernière. Okay.
Okay, it's not a question, but a very small notice. I'm Hassan Ismail, medical coordinator of AML Association. We have been working in the primary healthcare since like 40 years.
Since ever, yes.
Yeah, it's true. I want to shed the light on something very important. We were all talking about the role of NGOs, and unfortunately we have this reputation of bringing fresh dollars to Lebanon, which I really hate. We work in a humanitarian setting. But to be honest, please don't remember what's happening in Europe now. When the European Union, or the German Minister of Defense said, we need $100 billion to build a German army. So please remember that it's not anymore the age of NGOs in Lebanon, okay? This money is driven from there. They are forgetting the Syrian crisis. They are forgetting the refugees there, and they have other responsibilities now. So building our dreams on NGOs is not anymore rational. That's all what I want to say.
Thank you very much for this reminder, and thank you very much for all of you, and please welcome to the buffet.